What is occupational therapy? Occupational therapy helps people do the things they want, need, or are expected to do. We call these important activities occupations. These are the meaningful things that people do to occupy their time. For instance, getting ready in the morning, going horseback riding, reading the newspaper, having lunch with friends, watching videos on YouTube, feeding your child, playing in the sand, taking care of your pets, driving to the store, doing laundry, taking a well-deserved nap, going to church, doing your homework, or working a job. Sometimes people encounter roadblocks in their lives that keep them from doing these meaningful occupations. Maybe someone became injured or has a disability, or maybe they're just getting a little bit older. So, what do occupational therapists do? Occupational therapists help people move past these roadblocks so that they can participate in the activities that are meaningful to them. Occupational therapists help people with self-care, managing activities within their home and community, rest and sleep, education, work, play, leisure, and social participation. They work with people of all ages in all sorts of settings. At people's homes, in the hospital, in rehabilitation centers, in clinics, in schools, in skilled nursing homes, and out in the community. Occupational therapists take into account the whole person, including their values, beliefs, and spirituality, and the social, environmental, and cultural context of their life. So what does this look like? Well, an occupational therapist might help John, who's getting older, to make changes in his house so that he can live there longer. Another occupational therapist might help Sally, a woman with schizophrenia, discover new and meaningful occupations that make her life more rich. Samir, a child with autism, might work with his occupational therapist to make friends at school. Or an occupational therapist might help Raquel, who had a spinal cord injury, to drive again. Often, occupational therapists not only help people participate in their meaningful occupations, but they also use these occupations as a way to help people reach their goals. For instance, when an occupational therapist works with Mary, who had a stroke, to feed herself at the hospital, she gets more coordinated with every bite. And when an occupational therapist works with Miguel, who had a shoulder injury, to pick up his daughter, his shoulder gets a little stronger. To occupational therapists, being healthy is more than not being sick. It's about being able to live your life to the fullest.